Next is, yes. So this is different positions how to keep head, trunk, upper extremity and lower extremity. Okay. So how to keep an up head? Can you lie down? Huh? It should be neutral. Yeah, come on. Having an one roll. Okay, one roll here. Yeah, under the neck. Come on. One roll here, and to avoid flexion or rotations, we have to give again two rolls on either side, like this. Okay, so one roll to maintain neutral, one roll on, two rolls on either side. Okay, to keep the head in a neutral. Okay, now what movement you can do? What are the movements you can do? So you can have an head if there is no injury to the spine and all. Okay, you can go for gentle flexion extension, side flexion, and how will you do for rotation? The hand should be crossed from this, okay, to here, earlobe, supporting here, and do for rotation. Okay, then again on this side and go for rotation. Okay, so this is for side flexion and this is for rotation. Okay, if there is no cervical problem and nothing problem in the head. Okay, so these are the some head movement, head and neck movements you can do. That is for head. Okay, any problem? If there is some traction, you can't. It is anymore. Next is what? Trunk. Trunk means what? Scapula and pelvis. So again we have to keep rolls under the scapula. One on this side, one on this side, and rolls on the pelvis. Rolls under the pelvis to avoid hip flexion. To avoid hip flexion. Okay? So these are rolls you can use. And what are the movements you can do? That's what I told now. Scapular movements and the pelvic movements. Next is what? Upper extremity. Next is what? Upper extremity. Roll behind shoulder. Cone. Cone. You know cone? Cone triangle. You know ice cream?
Yes.
Cone. So keep a cone in the fingers and wedges inside fingers. Like wedges like. Okay, 1, 2, okay, 3, like this. This is what? Wedge. You can keep separate wedges like this. Wedging. This is to avoid adduction. Okay? And in movement, as I already told, always touch the lateral aspect. Okay, and in starting give movement for thumb and index finger. Thumb and index finger. That is very important because they are very important for precision. Okay, so upper extremity very important is upper extremity, making it an extended shoulder support. Okay, giving an cone. Cone. Next is what? Wedge. Wedges, not to get into an adduction, make it into an abduction. And for movement, always start with thumb and index finger movement. Okay, don't ever touch the medial aspect, always grasp on the lateral aspect. Okay, and what about the lower extremity? Pelvis in little protraction. Then what about the lower extremity here? Can you see there? No postures, ball duality. That's what. You should not touch the balls. Next, roll between legs. Roll between legs. Roll. That's what. Roll. Or anything. T-shape. Okay, so that is about position. So you have to demonstrate this position in your practical. So what you have to demonstrate in your practical, you have to demonstrate how to position for decerebrate rigidity, how to position for decorticate rigidity, okay, and how to position the head alignment, trunk, upper extremity and lower extremity, how to do a movements, what movements you will do, okay, and how to get into a sitting posture if patient is stable. This is what I need in level 1, 2, 3 of Ranco's class, Amago's scale. Okay. Next. We'll finish this and less things we will do next one. Next is what? One of the goal here is to improve the attention, arousal stage. How to improve that? By using different stimulation, visual stimulation. Visual stimulation. So what do you mean by visual stimulation? Huh? Video? Visual. Ask him to open his eyes, okay, and make him to see. That's all. Next is what? Auditory stimulation. Auditory means, come on, get up, get up. That's very important. Music? Very good. I am expecting you from that. Next is what? Yeah, that's good. If patient loves music, that's why in history, come on, in history we want to know what are all the habits or what is the social thing. If person is loving music, better to play music, which will allow him to do that. Yeah, definitely. That's one kind of treatment. Next is what? Tactile. Tactile means what? Tactile, touch. Generally, yeah, come on. For a traumatic brain injury patient, of this level, generally we can give tactile over the sternum, like this. Okay? To get stimulation, better you can give this stimulation over the zippy sternum. Next is what? Proprioceptive stimulation. What do you mean by proprioceptive? Sense of how you create a sense of position here? Movement of joint. Or how can you create a position sense? Bending. Putting a pressure. Now he can have a pressure here. Proprioception. Or sitting. Making him sitting, getting the position sense. That's a proprioception. May also cause person to stimulate. See, as a physiotherapist, lot of people in hospital, we have seen lot of cases where if they are physiotherapist will think that we should not make him sit. If you are not making him sit, he will go like this. Okay? Make him sit if medically stable. If medically stable and vital signs are normal, even though if you are making him sitting posture, making him in sitting. Huh? Unconscious patients, that's what I am telling. This is for unconscious only. If it is unconscious, no problem. You can shift him into the chair, you can make him sit in the chair, you can sit in the wheelchair, take him in a wheelchair. That's a treatment. That who will do? Physiotherapist will do. Okay? Understood? You have to do this. Then only you are a good physiotherapist. How will you get proprioception on hands? This. Or prone. No? Go for prone. Prone. Yeah. This is also what? This is also what? Proprioception. Proprioception on the joints. Do it. If you are not doing, patient won't recover. Okay? Next is what? Olfactory. Olfactory means what? Smells. Give a different kind of smells. Okay? Yeah. Next, gustatory. Taste. Last is vestibular. How will you do vestibular?
Share the
Head movement. Head movement.
share rotation.
Okay? So let it be he is and comma. Can you close your eyes? Okay? Now he is an vestibular person and doing, see, now just think that how many sensations I am using. Okay? First is touch. Okay. Now putting pressure, proprioception. Okay. I am using my auditory. Come on, get up. Okay. That's an auditory. Next, moving from one, back and forward. Okay. Moving forward and backward. This is what? Vestibular. Not moving head. Okay. Moving the body. That's an vestibular. That's an vestibular. Okay. So if you use all these stimulations, definitely patient will come to next level. That is level 4, 5, 6, 7, 8. Otherwise he will be in level 1, 2 and 3. Okay. So it all depends upon physiotherapist. It all depends upon physiotherapist.
Finish.
This is only 3 steps. Cut.